I am so delighted to meet you in the program of JIP's 3 PM Medics, 3-point Medics. The most important game changer molecule in the management of heart failure of late is ARNI. You are all aware that ARNI is nothing but angiotensin receptor neprilysin inhibitor. So how this drug is helpful in the management of heart failure? So before that, just you have to understand the pathophysiology of heart failure. The pathophysiology of heart failure involves maladaptive response to two important systems. So what happens when heart failure occurs? When heart failure occurs, there will be decreased blood flow to the kidney. So renin-angiotensin system, aldosterone is activated, or otherwise called RAS system is activated, resulting in few consequences. One, when RAS is activated, angiotensin 2 causes intense vasoconstriction, resulting in increased blood pressure. One. And second one, it increases sympathetic activity, so there would be much fluid reabsorption from the proximal tubule of the kidney, so there will be volume overload. And three, and it causes increased aldosterone secretion from adrenal gland, which in turn causes fluid reabsorption, resulting in there is ultimate cardiac remodeling, which causes detrimental to the heart. The compensatory mechanism, that is RAS, that is produced with the consequence of heart failure, slowly turns into be a villain in the heart failure. So the RAS system should be, the compensatory RAS system should be deactivated in the management of heart failure. This is one system. And second one, when heart failure occurs, the dilated ventricles releases brain natriuretic peptide, that's called BNP. When natriuretic peptide is stimulated, so what happened? Here there would be opposite effect of RAS system. I mean, there is vasodilatation and there is natriuresis and there is diuresis. So what happened? The fluid will be excreted from the body by means of urine. So there will be an opposite effect to RAS system occurs in natriuretic peptide system. So there are two systems activated in heart failure. One is RAS and another one is natriuretic peptide system. Unfortunately, RAS system is detrimental to our heart in heart failure, and natriuretic peptide system is beneficial to our heart. So now they have developed the drug in such a way that your RAS system should be deactivated. So they add angiotensin receptor blocker to deactivate your RAS system. What about natriuretic peptide system? This brain natriuretic peptide in our body is very short-lived. Once it is produced, it is immediately deactivated by one molecule that is called neprilysin. This molecule neprilysin causes immediately deactivates your brain natriuretic peptide system. So if you want to protect or activate this natriuretic peptide system, which is considered as a beneficial to our heart, that should be protected by any other means, for which you have to inhibit this neprilysin. So they have founded one molecule that is called sacubitril. This sacubitril inhibits neprilysin. So you add angiotensin receptor blocker to deactivate RAS system, and you add sacubitril which inhibits your neprilysin, which in turn activates your natriuretic peptide system. So because of which we always combine ARB and neprilysin inhibitor, otherwise called sacubitril. Here we prefer valsartan as an ARB, and naprilysin inhibitor we add sacubitril. So valsartan plus sacubitril combination is considered most beneficial in the management of chronic kidney failure with class 2, 3, 4 manifestation. Thank you.